Hello again, everybody. It's Kevin Henry, editor-in-chief for drbicuspid.com. Welcome to part 4 of our series with Dr. Roger Levin on 5-star customer service. I truly hope at this point you've listened to the previous 3 because there are so many nuggets of knowledge to pick up along the way, and I really think that they are game-changing. And I know today is going to be as well, Dr. Levin.
Today will be because we're getting very, very granular or practical. I mean, we've already hit many, many points, but I'm really excited to share today with everybody.
Then I'm going to turn it over to you, and I'm going to listen like I always do, my friend.
All right, well, here we go. Our first segment today, and welcome back, everybody. I really hope that you're having a great time with this. Please use these podcasts as training guides with your team. They will benefit. Customer service is not natural for most people. You know, there's a natural here and there, but for most people, the more skills we get, myself included, the better we're going to be. So our first part of this podcast is called Make Your Patients Your Friends. And I mentioned that to you in an earlier podcast. I repeat that over and over when I'm teaching. Make your patients your friends. First of all, what a great mindset. I'm going to go to work with my friends instead of my patients. And right now, some of you are thinking about the patient you hate, that you absolutely hate. And it's like, well, I don't want that patient to be my friend. Years and years ago, I remember we had a client who every year on his birthday, even if it was Saturday or Sunday, would be in his office privately, his private office at 6 a.m. Now, this goes back like 35, 40 years, so you have to put it in context. And he would type a letter himself. He would type it out himself to one patient, politely kicking them out of the practice. That was his birthday gift to himself. The patient that he liked least in the entire practice, he would invite to go elsewhere. Now, it was a different era, so put it in context. I'm not suggesting you do that. What I am suggesting is most of our patients are great. And I think most people are great. And make your patient your friends. Now, there are 2 things you need to know. The first one is called the golden 10. When a new patient comes in, do not touch that new patient until you know 10, literally 10 personal things about that patient. And it can take as little as 5 minutes. But you start by building a relationship. We measure for our clients at Levin Group longevity, average patient longevity. And I can tell you that in the best practices, remember, we have this 31-year ongoing study of top 10% producing practices, the only one of its kind. As I always say, I wish there were more so I could compare notes with others. But in that study, which is both objective and subjective, it's been going on for 31 years now, we ask the question, what makes the top 10% of practices in production the top 10%? And we found 17 principles they have in common. And one was, and I've already shared this with you, they have about 360% larger patient bases on average than the average dental practice, which gives them a lot of flexibility and protection and production. But putting that aside, I mean, just think about it. The more patients you have, the more people they can refer. It's very simple. So putting that aside for a moment, when a new patient comes in, we found subjectively that these top practices just build better relationships. They just get along. They have great, one of the principles was they have better customer service than most practices. Not that you're bad, you may be average, you may be good, but they are great. And that's where the difference lies. So when you have a new patient, learn an interview process, because psychologists will tell you once you know 8 things personally about a person, or 9 or 10, you're moving from professional relationship to personal. I don't want professional relationships with people. I like personal relationships. I'm pretty transparent. I'm happy to share about me. Not that I'm all that interesting, but I'm still happy to share it. I'm lucky. I am naturally curious. I ask a million questions. I often go to a dinner with friends where the friends have a certain expertise. I bring a question in my own head that I'm curious about. So get curious about people. But the golden 10 says don't touch a new patient until you know 10 things about that patient. Okay, that's number 1. Number 2, learn one new thing about every patient every time they walk in the office. Now, if you look at a patient and you say, Kevin, what's new? You're going to get what I call a garbage answer. The most common answer to what's new is nothing. What's new is not really a question, Kevin, anymore. It's a greeting. Hi, Kevin, what's new? It's like, hi, how are you? I don't actually care, but I say that because I'm supposed to. It's not real. So just change the words. If you say to people, "Hi, Kevin, what's new in your life?" You'll actually get a decent answer because your brain says, "What's new?" I'm going to say, no, oh, wait a minute. He didn't just say what's new. He said, what's new in your life? There's something different about that. I think I'll answer the question. And you do get answers. Everybody has a story. Everybody has new. Everybody has good things, bad things, theories, ideas, opinions, beliefs. Let them tell you. Now, if you hear something you don't agree with, like somebody says something political, and you're 180, we are dental practices. It's not our job to perpetuate politics. Nobody goes to the dentist to get a political point of view. So again, I taught this in the last segment. You say, I can certainly understand how you feel. Or another one, thank you for sharing that with me. Don't discuss sex, religion, or politics in the office. That doesn't belong there. You're going to offend somebody. But learning one new thing about every person every time. Parents love to talk about their kids. Kids love to talk about their friends or school or whatever, or sports. They're people. I used to, in my day, before I knew a lot of this, when I was in practice, I would put a note down, loves sports or loves restaurants or loves to travel, so that when they came in, this was back in the days of charts, I could look at the chart and say, oh, Kevin likes to travel. Kevin, where have you been lately? Or what's your next trip? Great question. I mean, I've got 2 dozen questions I can ask that get answers from most people. My friends, they take vacations at least. I've never said to a friend, what's your next trip? They go, I don't take trips. There are people you might not ask that to, but they do something else. So make your patients your friends. And the best way to make friends is learning about people, being curious about people. It's just an incredible way. By the way, you'll learn. If you get in the habit of asking questions when you meet people, you will learn amazing things. Okay, now that's called make your patients your friends. The next one that I want to focus on is, are you losing your patients or keeping your patients? And I mentioned in the last segment an article I had written where I pointed out that the loss of patients, and you're all going to have lost patients, will cost you millions of dollars in your career. Now, some you can't help. It's legitimate. They moved, they died, it happens. For example, we'll get a client who's got a nice practice, but the average patient age is really skewed way up. We say to them, we got to get new patients in here because you're solid today, but within the next 5 to 10 years, you're going to get a drop off. Now, you might be thinking, well, I'm a dentist, I'm 70, I won't care. But the person buying your practice is going to care. They forget to look at the age of patients because that's not part of a valuation normally, but they're buying an aged practice that's going to fall off. We see some serious problems with that when we're the consultants, because we get brought in 2, 3, 4 years later when things are going the wrong way. Okay, are you losing your patients? Yes, you are. And the analogy is, look at how we eat. We don't start eating well till after the first heart attack in many cases, right? You have a heart attack, and I know so many people, they had a heart problem of some sort, and now they have religion and they are doing seriously better nutrition. Okay, what's the analogy there? You don't see your lost patients. It's 1 here, 2 there, a family there, and a lot of them, most of them don't call you up and say, I'm leaving. I'm going to leave the practice. What is it that causes us to lose patients? Okay, number 1, poor customer service. If they touch your office and feel like you don't care, you're not being flexible, you're not taking care of them, they're going to leave. Example 1 is helping them with their dental insurance. Now, we see a lot of new clients who do nothing to help their patients with dental insurance. They take it, but when there's a problem, they don't intervene. The patients are lost. They can't navigate it. They don't get it. The elderly definitely often have no idea what's going on. They're reaching out to the practice for help because you're the healthcare provider. They don't know anybody at the insurance company. They don't know Sally Jones, who is the head of reimbursements at Delta. They know you. And whoever's in front of us is who we reach out to. They expect you to know the answers. I know you don't know the answers. That's why we're a consulting firm. If you had all the answers, we wouldn't be necessary. But they don't know you don't have the answers. So whenever you're asked a question you can't answer, you don't say, I don't know. Call the insurance company, take care of it. It's your responsibility. Maybe all that's true, but those are really bad customer service answers. Here's the answer. I don't know, but I will find out. You call for them. You help them. They're never going to leave you if you're the one who is so important in helping them to get it right. So, one reason is that. Number two, they can't get an appointment for 4 months. I have a friend who just called me very recently and said, I need a new dentist. I said, what happened? Did your dentist retire? Whatever. Sometimes I hear horror stories. He goes, no, I was overdue for my cleaning, he called it, and I can't get in for 5 months. He's going to a new office. So that office just lost a patient who had been going for 20 years. By the way, not that I suggested it, but I will predict his family will eventually follow him. But he was miffed that he couldn't get in for 5 months. And maybe that's legitimate in some practices, but it causes you to lose your patients. Number three, they don't understand the fees. So many patients get treatment presentations, they come up front, and they look at the front desk people and they say, I don't get this. I don't understand what they were saying. They don't tell the dentist, they tell the front desk. By the way, 4 out of 5 patients, this is a study we did, will ask a clinical question when they get to the front desk. And I remember the story of one front desk person, was an implant case, and the patient, was going to have the implant done. And they ask you questions that are silly but important, like, well, gee, Kevin, would you do this? And the front desk person looked at the patient and said, oh, I got an implant and it was incredibly painful. That's not necessarily what you want to communicate. So you got to think about what you're saying. Front desk people, you are incredible customer service ambassadors. And your job is to reinforce the case presentation or any question that they have. How much will my insurance cover? Well, do they always pay for this? Is there any way I can get more coverage, et cetera? These are questions you have to be prepared for. Another reason you will lose patients is emergencies. Now, there are 2 types of emergencies. One is an emergency, one is not. Either way, let's remember, customer service means being customer centric, thinking about the customer, not yourself or your practice. If they think they have an emergency, it's an emergency, but there are 2 types. The first type, they're in pain. Our rule at Levin Group is if they're in pain, get them in. Well, how do we know if they're in pain? Don't ask a patient if they're in pain. The answer is always yes. Even if it's like they broke a tooth, there's no pain. Are you in pain? I feel it. Okay. To them, they're in pain. So we change the question to, are you in extreme pain? Okay. Now people give you a better answer. Yes, we're going to get you in today. No, now we can look and get you in this afternoon or tomorrow morning. But you always end with, but if anything changes, call me back. I'll get you in right away. I am your customer service representative. You got a problem, you call me. Practices that have this sense of responsibility that we will take care of you no matter what. And again, you can negotiate for 10 o'clock tomorrow morning in a non-extreme pain emergency, but you make it clear to them, but if anything changes, you call me right. I know staff members that give their cell phones to patients. They're not afraid to do that. But if you don't get a real emergency in that day, they will go elsewhere and they may never return. We're really good at teaching practices how to keep emergency patients that came to them for the first time because their dentist was unavailable, out of town, whatever. Another one is a tough one, and you'll have to make your own decision. I don't have a key recommendation. Your patient hours. There are people who don't want to come during hours. So at the very least, get your business people in early morning, late afternoon. Every front desk has heard a million times, oh, I have to come in the afternoon because I work. Every orthodontist on the planet knows all mothers want to bring the kids in the afternoon after school. Nobody wants to take the kids out of school. We've got scripting for all that. But try. And by the way, a great customer service technique, know the favorite appointment time of every patient. I've been going to the same physician forever. When I make my appointment for my physical, they say to me, you like the first appointment of the morning. And I do, because then you don't wait. Okay. I don't like waiting. So I like the first appointment of the day, but they know that. And I'm pleased that they know that. Now, Part of knowing that is because the people been there so long. But it could also be in my record. Roger Levin likes first appointment in the morning. Put it in the patient record. Kevin Henry likes last appointment of the day. Or Kevin's retired. He has nothing to do all day but watch baseball. By the way, everybody, Kevin's a baseball reporter as well and brilliant on baseball. He got nothing to do. So there's no game on usually at noon. Kevin can come in midday and fill in those less desirable times because he has nothing to do. Move your seniors to midday. By the way, seniors, that's a whole different customer service, but I'll make the point now and later. They love to come into your practice. It's a social event. Many are lonely. Many can't get there. Another customer service, they don't have anyone to drive them. Their kids live 3,000 miles away. For some 79-year-old, send Uber to pick them up. It costs you pennies. Oh my God, what an amazing thing to do for people. Again, whoever makes it easiest wins. I taught you that, but if you want to keep your patients in today's world, you go over the top. And here's the other reason that I wouldn't have said 20 years ago. The younger generation that's now up to their mid 40s, they don't mind changing dentists. The loyalty's gone. These are people who go online, they find a store to buy what they want. They don't know the store. They don't trust or not trust the store. They know how to go online, find what they want, and go away. The streaming services, Netflix, Hulu, Disney, their biggest challenge is nobody cares about Netflix, or nobody says, oh, I'm a Netflix person, or I'm an Amazon Prime person, or I'm a Hulu person. What they'll go on there for the free month, watch what they were watching, and get off. There's no loyalty. They move around based on well, the same thing is how some of them view dentists. If you're not over the top in customer service, I'll go to this dentist today, this dentist in 2 years, this dentist in 6 months. They don't care. It's all the same to them unless we make ourselves truly, truly valuable for them. So, are you losing patients? Yes, and it costs you. And it costs you heavily because one rule of customer service, keeping a customer is much cheaper than acquiring a new customer. It's much cheaper to keep a customer than to get a new one. Keep the ones you have. That is just so important. And being good is not good enough. So you go out of your way. When a patient walks in, I mean, do you stand up to greet them? Do you give them and I'll get into all this in future segments here in detail, but how do you greet them? And I'll tell you more about that from the Ritz-Carlton. Do you smile? I told you about that in an earlier discussion. Do you make them feel like they're the only patient on the face of the earth? I hope when I talk to a client, we have a whole consulting group. I only have 6 clients of my own, and that's for something called executive coaching. But when I talk to a client of a consultant, they've got a question. Every client knows they're welcome to reach out to me, and I will set up an appointment to help them. They got a question or strategic or a decision, but I hope I make them feel like I have nothing else to do that day. And Ron Shapiro is one of the greatest sports attorneys of my generation. He represented some of the great athletes. You would know their names. He settled a huge baseball umpire strike that nobody else could settle. And Ron always talked about that when he was negotiating, he'd get a call to negotiate. He had a sheet that he kept next to his desk. And he'd pick up the sheet and throw it over his desk so that he did nothing but concentrate on that call. We all, if you're watching me right now at your desk, you're also looking at this, that, the other, perhaps. He would put a sheet over his desk. He was known as the nice negotiator, not the mean negotiator. And he was very respected. But that's my point. I want anyone I talk to feel like they're the only VIP I'm focused on right now. And I hope I do that. I hope I do it most of the time. Sure, I'm not perfect, but I try when I'm talking to somebody to be focused just on them. And that is making your patients your friends. That is how you keep from losing patients. If you knew how many patients you lost a year, you'd be shocked. You don't measure it, and they don't call you and tell you. So it's a hard measurement, but trust me, go back and look at how many patients are 1 month overdue, 6 months overdue, 5 years overdue, because the 5-year overdue is never coming back. The 2-year overdue is probably not coming back. And those are revenue dollars out the door. Those are referral sources out the door. Those are filling the chair people out the door. Are you losing your patients? Yes. And great customer service will help you to keep them. That's this segment, Kevin.
It's a great segment. And I love that you talk about well, I don't love, but losing patients is a reality. And I think so often patient retention numbers are one of the biggest KPIs that people don't look at. They love to look at their new patients that are coming in and everything else, but that's a number that I feel like often gets overlooked.
Yeah, and I don't want to get ahead of myself and keep repeat. When you teach customer service in a series of podcasts, I'm going to repeat myself, and I think that's good. It's okay to hear some things two or three times, but one of the biggest ones I haven't gotten to yet of why you lose patients, you don't treat them well. You don't treat them well. And my antidote, and I'll cover this again, is very simple. Doctors and staff don't get to have a bad day. Maybe I'm unfair, maybe I'm irrational, maybe I'm unreasonable. You're in a service business. Doctors and staff do not get to have a bad day. If you're having a bad day, take it. Okay. Because you owe every patient, in my opinion, as part of their fee, a great customer service experience. You don't get to have a bad day. The person who scares me in life is the person who says, I'm always honest, which means that's my statement that I now have an excuse to be obnoxious. No, no, you don't. If I do something you don't like and it needs to be corrected, that's great. But I don't need you correcting what I don't need to know. If you don't like my shirt, if my hair doesn't look good, if my shoes aren't shined, I don't need someone to tell me that. That's the I'm always being honest approach versus make everybody feel great. A lot of people leave simply because you don't treat them well. And it only takes one moment in a 30-year patient career with you to have them decide to leave. And they've got plenty of options today.
Absolutely.
Yeah.
I one of the mailers I got, I mean, I've lived here in Colorado for more than 15 years now, and I still get those mailers about new dentists and come try us out and everything else. And one of the ones the
Yeah.
other day was bring this in for a free second opinion. And I thought, how interesting is that that now, because you talked about last time about not bad mouthing people, but I thought, boy, bring that in and say, are they really telling me the truth? Interesting.
Yeah, on my way to work every day, I pass one of the biggest DSO branded dental offices. They're open 6 days a week. They're open at night. Their fees are lower. They take every insurance on the planet. So, having said that, for every dentist listening, and I'm not criticizing them at all, that's a smart model. For every dentist listening, ask yourself a question. Why should my patients come to me? And the answer is not because you're a better dentist. People judge you more by customer service, how you treat them, than by the dentistry that you provide. So, yeah, if I were still in practice every day, if I passed that office, I would say to myself, why should my patients come to me? Where do I have to be better? Because I don't work Saturdays and Sundays. I don't work evenings. My fees are higher. Why should they come to me? Don't assume they know you're a better dentist because they don't.
Great point. It
Yeah.
absolutely is. And this podcast was full of great points, just like the previous 3 were as well. And so I really appreciate it, Dr. Levin. I'm anxious to see where you're heading in the next part of these podcasts as well.
We're going to have a great time and hopefully help a lot of people. That'd be terrific.
I have no doubt about that, just like Levin Group has for so many years. And make sure you check out levingroup.com. We will have that in the show notes so that you can learn more about Dr. Levin and all the services that they offer as well. But Dr. Levin, as always, thank you, my friend.
Thanks, Kevin. See you next time.
I'll see you then, and we'll see all of you next time as well. Thank you so much for listening to this episode. Kevin Henry signing off, and as always, wishing you nothing but success ahead.